Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, January the 6th, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, thank you, Brad, and good afternoon. Today, I'm pleased to confirm that the City of Toronto and Toronto Public Health have answered a request from the Province of Ontario to work with our Toronto hospital partners to support the vaccination of all residents, healthcare workers, and essential caregivers in long-term care homes by January the 21st. 30 long-term care homes, including 5 city-operated homes, have begun to receive the vaccine since December the 31st. Approximately 1,800 staff and residents from within city-operated long-term care homes have already received the COVID-19 vaccine, including residents and staff from Bendale Acres, Castleview Witchwood Towers, Fudger House, True Davidson Acres, and as of today, Kipling Acres. These are all non-profit long-term care residences operated by your city government. And I'm pleased to say that more than 80% of residents in city-run long-term care residences have provided their consent to be vaccinated. This has worked so well that the province has asked us to work with them to help ensure that we get vaccinated those residences of all long-term care residences across Toronto beyond the ones that we ourselves operate. We are working with the province and our hospitals to answer this call and to get residents and staff in the remaining long-term care homes vaccinated. While overall vaccination policy and the parameters of this long-term care initiative are the responsibility of the province, this is an all-government, all-hospital, all-hands-on-deck effort, as you would expect when it comes to providing care for some of our most frail elderly. So that you're very clear on what is a clear division of responsibility for COVID-19 vaccinations, the Government of Canada is responsible for obtaining the supply of COVID-19 vaccines. The Province of Ontario has responsibility for distributing the vaccines and for deciding who gets vaccinated when and where. And Toronto is responsible for supporting the administration of the vaccine in accordance with provincial prioritization and scheduling frameworks as vaccine supply is distributed by the province. While much of the vaccine rollout is beyond our control, I am determined, and I know that Chief Pegg and Dr. de Villa and everybody on our public health team and our immunization and in our city government are determined to do all that we can at the City of Toronto level to make sure that we get as many people vaccinated in our city as quickly as we possibly can. Beyond long-term care workers and residents, we are working on getting other frontline workers vaccinated as quickly as possible. The 1,300 paramedics in our city who have done such a fantastic job during the pandemic and, of course, every other day as well, are an extension of our emergency departments and play a vital role in our response to the pandemic. Getting them vaccinated will not only protect all residents, but also other frontline workers. Our Toronto Paramedic Services Community Paramedicine team will be immunized by staff at 2 of our partner hospital sites today and tomorrow. That team, in turn, will be trained starting today on how to administer these vaccines to other Toronto paramedics. And beginning tomorrow, in partnership with Sunnybrook Health Sciences Centre, Humber River Hospital, and the University Health Network, all Toronto paramedics who wish to be vaccinated will be able to obtain the Pfizer COVID-19 vaccine at one of these 3 sites. Vaccination sites, these 3, will be open 7 days a week and will be able to accommodate vaccinations of up to 50 paramedics each day, 50 paramedics per site, so 150 in a day. I want to say thank you to everyone who is working to get people vaccinated right now. Thank you to the frontline healthcare workers who are already stepping forward to get vaccinated, and thank you, of course, to our task force led by Chief Pegg, who is coordinating all of the city's participation in these efforts. Getting vaccinated is absolutely, positively the right thing to do whenever we get the opportunity. Being outdoors safely can also be a very healthy thing if done right, especially given the natural ventilation you experience compared to indoor settings. A month into our skating rinks being open for winter, an arrangement designed to offer safe outdoor places to go and to be active in winter months, I can confirm that 440,000 online skating reservations have been processed by your city government. This number shows that people are eager to get out and to be active during the pandemic while still following public health advice. As you know, we have limited capacity on the rinks. That's part of what we're doing to keep people safe and healthy. And we have other requirements such as wearing a mask in order to comply with public health advice and with provincial orders. Again, safely, within the rules, and in a healthy way, we want people to go tobogganing, to be active and to be entertained during this pandemic winter. To that end, we have identified 23 different hills where Torontonians can toboggan, snow conditions, of course, permitting. I want to thank people for following the rules and keeping their distance from others outside their household on these hills, and for wearing masks as much of the time as possible. Ski hills remain closed to all activity by virtue of provincial government order. You'll recall that as part of our Welcome TO winter plan, city parks have an additional 60 kilometers of paved recreational trails and pathways that are being given snow maintenance. 100 of our parks have winter maintenance, including 60 with enhanced maintenance this year that includes cleared paved pathways and parking lots. Again, we want Torontonians to be comfortable and safe making winter visits to an increased number of city parks during this winter pandemic. Following basic public health rules applies here too, but we want people to feel safe, and we want people to feel safe being outside, which will, done right, make for better physical and mental health for the residents of Toronto. The city has posted the locations where we have increased winter maintenance in our parks on its website, toronto.ca. At my request, staff are also working to post a map similar to what is available now for tobogganing hills so that people can find those locations easily where winter maintenance is in effect and where that should allow for a more comfortable, safe walk or visit to the outdoors. Like many of you, artists of all kinds have been very hard hit, including musicians, very hard hit by the effects of the pandemic. Today, I'm pleased to announce that the City of Toronto, in partnership with Unison Benevolent Fund, is launching City Hall Live Spotlight, a weekly live-streamed concert series. This new series will provide us opportunities to experience homegrown talent virtually and to support the local music industry, which needs our support now more than ever. City Hall Live Spotlight will feature professionally produced live-streamed videos of Toronto musicians performing at music venues and other music-related businesses around the city that have been affected by this pandemic. It is scheduled to run weekly every Thursday through to the spring. Each performance will be accompanied by a brief introduction about the location that the concert is being performed and its role in Toronto's music sector. The series of concerts will kick off next week on Thursday, January 14th at 7:30 p.m. The first performance of the series will feature a Toronto resident and Colombian-Canadian artist, Lido Pimienta, a Grammy Award nominee for her 2020 album Miss Colombia and winner of the 2017 Polaris Music Prize for her album La Papesa Live from the Phoenix Concert Theatre. Performances will be available at facebook.com/City Hall Live Spotlight and happen.op, an exciting new Toronto-based live streaming platform that enhances the music concert fan experience and improves the revenue stream for the artists. Backline for City Hall Live Spotlight, such as drum kits and keyboards and amplifiers, have been generously provided by Yamaha Canada. I want to assure people that at all of these City Hall Live Spotlight shows, adherence will be strict to City Hall and public health protocols, and there will be no in-person audiences. Residents will be enjoying this music from the comfort of their home only. As I mentioned earlier, the pandemic has severely impacted the music community in our city. Pre-pandemic, Toronto's music scene was absolutely thriving. It not only produced some of the world's most recognized and celebrated artists, and not only represents thousands of jobs overall, but music, as we all know, represents that one universal language which brings people together and has, quite frankly, I think, helped a lot of people get through this awful pandemic. We need to do everything possible that we can to make sure that the industry is in a position to succeed when the pandemic is over and to emerge still strong, and to encourage the artists who are so much a part of that industry and others involved in production and so on to be able to be at their best when the pandemic is over. During each performance, viewers who are able to do so can choose to make a donation, 100% of which will go to the Unison Benevolent Fund's vital work to help musicians and music industry workers who find themselves in crisis. My job as mayor has not only been to help Dr. de Villa and Chief Pegg and Councillor Cressy and City Manager Chris Murray to manage the pandemic and to keep you safe, but also to make sure that we have a range of supports and activities to keep you healthy, mentally and physically, during what I know is a very difficult time. We will continue to do that, in addition to doing what you have the right to expect, namely to protect and to continue to deliver, in whatever best way we can, the vital city services that we know that you rely on each and every day. I'd now like to pass it on to Dr. de Villa, who has today's latest numbers to present.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 837 new cases of COVID-19. 406 people are in hospital. This is a high and worrying number. 89 people are in the ICU. Toronto Public Health is moving forward swiftly in its role on the teams established to support COVID-19 vaccinations for residents, staff, and essential caregivers in the 87 long-term care homes in the city. In Toronto, long-term care homes are connected to local hospitals in a hub-and-spoke model of care and service. Those hospitals are providing invaluable hands-on presence in administering vaccines to those who need them most and soonest. As you've just heard from the Mayor, significant progress has been made in the delivery of vaccinations at more than a third of these 87 homes. Partners in health from all sectors and jurisdictions are working together in a reassuring level of cooperation and determination. I have full confidence we will meet the January 21st deadline. This is welcome news for everyone in Toronto, those living and working in the long-term care system, and all of us who have watched with sadness the terrible toll that COVID-19 has taken there. What is concerning for all of us in Toronto are the rising pressures on the city's hospitals. I speak regularly with my colleagues in the hospital sector and share their concern about the weeks ahead. First, I want to deliver a message that it is important for everyone in Toronto to understand. And it's this: if you need urgent medical care, call 911 or go to your nearest hospital. I know many people have expressed unease at the idea of going to hospital for fear of contracting COVID-19. The hospitals continue to provide emergency care and have significant programs in place for infection prevention and control to manage COVID-19. Trust your instincts. If they are telling you that something is seriously wrong, something that requires immediate medical attention, don't delay. There has been too much suffering and too much loss of life because of COVID-19. Please do not allow fear to cause more. But if you are well, I ask you to please do everything you can to stay that way. As able as the healthcare system is, it is delivering care under enormous struggle as COVID-19 cases surge. And there is little reason to expect that case counts will decline anytime soon. In the 837 cases I reported to you today, people aged 20 to 29 were the age group with the highest number of cases at 181. Today, the youngest person amongst those newly hospitalized is 23 years old. I understand from discussions with my hospital colleagues that admissions of younger people are reaching noticeable levels. Overall, 87% of ICU beds in Toronto are now occupied. 89% of acute care beds are now occupied. In the past month, we've seen a 14% increase in cases currently in hospital and a 57% increase since early November. Our data suggests that we will continue to see a climb in hospitalized cases. This is certainly the expectation in the healthcare system. And while the hospitals are providing the care they typically deliver under normal circumstances, they are also simultaneously delivering COVID-19 related care. In some instances, managing outbreaks, supporting infection prevention and control programs in long-term care homes, and many are delivering vaccines on site and now in long-term care homes as well. While we are expecting so much of the healthcare system, there are concerning findings from Toronto Public Health's online source of infection survey that's given to cases of COVID-19. Most recently, respondents indicated that during the period between December 22nd and January 4th, almost 32% gathered in a home, either theirs or others, with 10 or few people, as compared to 21% who indicated that they had done so in the weeks prior. Also, the proportion who reported close contact with a non-household member increased to 44%, having been 30% previously. The outcome of those decisions will emerge over the next days and weeks. If they manifest as COVID-19 cases, the implications are plain to see. But the thing is, it's never too late to change. We must do all we can as individuals to protect and maintain our own health, so the healthcare system can provide care as easily as possible to those who will need it urgently in the weeks ahead. I'll now turn it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. de Villa, and good afternoon. Our immunization task force continues to be hard at work, supporting the continuing implementation of the COVID-19 mass immunization campaign. We continue to work directly with General Hillier and the Province of Ontario's Vaccination Distribution Task Force, Toronto Public Health, and our hospital partners on this important work. We will ensure that we are ready to launch our mass immunization clinics in accordance with provincial prioritization and scheduling frameworks as soon as vaccines are provided to us by the province. The province has established an ethically prioritized framework for determining the sequenced rollout of COVID-19 vaccines across the province. The current phase of this continuing rollout includes residents, staff, and essential caregivers in long-term care homes, along with other essential health care workers who are among the first to be vaccinated. There are approximately 2,600 residents and 3,000 staff across the 10 city-operated long-term care homes. Since December 31st, approximately 32% of the residents and staff in our city-operated long-term care homes have been vaccinated against COVID-19. I am very pleased with the progress being made on vaccine rollout within our city-operated long-term care homes thus far. The City of Toronto and our Immunization Task Force are committed to ensuring that the most vulnerable residents of the city receive COVID-19 vaccine in the earliest, safest, and most efficient means possible. we are hard at work, alongside our provincial colleagues and hospital partners, on achieving our goal of vaccinating all our long-term care residents, healthcare workers, and essential caregivers by January 21st. In accordance with the provincial vaccine distribution framework, we are also continuing to move forward with the vaccination of other essential healthcare workers who have been identified for vaccination by the province. To that end, I'm very pleased we are now beginning to vaccinate our frontline paramedics, as noted by Mayor Tory. Vaccinating our paramedics is in line with the provincial framework and is an important step in the continuing development of our mass immunization campaign. Our Toronto paramedics will be expected and called upon to take on many important roles across the city, including administering COVID-19 vaccines as we move forward. The city is working with University Health Network, Humber River Hospital, and Sunnybrook Health Sciences Centre to move forward with the vaccination of our paramedics. The goal of the City of Toronto's Immunization Task Force remains both simple and unchanged: to make COVID-19 vaccine available to everyone in Toronto as very soon as we can and in the most efficient and effective means possible, while considering both the provincial prioritization criteria and vaccine availability. Moving forward with the paramedic vaccination program is an important step in achieving that goal, and I would like to express my thanks to our hospital partners for their continued collaboration, support, and assistance in this important work. Thank you.
Thank you very much, Chief. Before we go to questions, just a reminder to reporters to please unmute yourself before you ask your question, and we'll go first to Matt Bingley from Global News. Hi, Matt. Go ahead, please.
Hi, good afternoon. Two questions to both Mayor Tory and to Chief Pegg. I'm just wondering, we're hearing a lot more about the possibility of a curfew coming in. I'm just wondering, Mayor Tory, if you would be in favor of one of those to actually see some sort of control gained over the situation here. And to Chief Pegg, I'm wondering if you've begun any planning on how implementation or enforcement could work with something like that.
Speaking for myself, I've been governed throughout in all of the different things that we have recommended or urged upon the province or ourselves, the public health advice that I receive. And if somebody said that the medical officer of health and her team or other medical experts said that some kind of restriction on when people could come and go was going to significantly increase our effectiveness in wrestling this virus to the ground, then I wouldn't rule it out. As of this moment, there's been more mention of it by people asking media questions than there has been in, I'll call it, official circles. But having said that, I wouldn't rule anything out if it was going to be effective and it was going to be consistent with the best advice we could get from the medical and scientific experts.
And Matt, while I understand that some of those discussions are ongoing at the provincial level, we have not been provided with any information at this point with respect to any additional restrictions, and as such, no active planning has been commenced at this point. The way the process has worked from the beginning and from the outset is once any type of restriction or other provisions are enacted by the province, we then need to understand the detail of that, understand the legal framework, and then we set about to understand that from an enforcement perspective and make sure we're ready. But at this point in time, that has not begun, as we have not received anything from the province.
Thank you. And to Dr. de Villa, just on the hospitalizations, you said that they were a concerning rise there. When it comes to the rate of hospital admittance in the past couple of weeks, I'm wondering, are you seeing just like a real stark uptick as far as speed of the number of the rate increase there that is driving your concerns?
Well, you know, Matt, I think we are seeing rises in new hospitalizations and in the total number of people in hospital. And as I indicated in my remarks, there's been a 14% increase in cases currently in hospital in the past month, 57% increase since early November. And I think it's really, very concerning when you have the opportunity to speak with the healthcare workers who are in hospital. They are noticing that they are getting more and more by way of COVID-19 cases. And they note as well that it is, relative to what we saw in the spring, definitely a younger population, but still requiring hospitalization. So I think there's a lot of reason for concern, certainly. But as I also indicated in my remarks, it's not too late to change. There's still much that we can do. And it really does come down to each and every one of us doing the very, very best we can to limit our interactions with people from outside of our households.
Thank you. We'll go next to John Chidley-Hill from the Canadian Press. John, go ahead.
Good afternoon, everyone. My first question is for Dr. de Villa, and maybe Mayor Tory would like to weigh in afterwards. Would the city consider extending the closure of schools to in-person learning, like Windsor did in December, even if the province allows a return to school for elementary students as planned on Monday?
So, when it comes to the health and safety of our children, obviously we're very concerned. We want the safest outcomes for our kids. And just going back to the earlier question that I was asked, we have a lot of COVID-19 activity in our community. And we know that high levels of COVID-19 activity and levels of COVID-19 spread in our community give rise to greater risk. So I certainly have some concerns around what this means for children in our community, and have registered those concerns with our provincial counterparts, and we're continuing to have active discussion on that front. But again, to my mind, the most important thing here is what are we doing to enhance the safety and the health of children within our city and their families as well.
I will just say, for my own part, I will accept the advice that I'm given by the Medical Officer of Health, as I've done throughout. I take note of the fact that schools relative to other places have been a source of concern, but less of a source of concern than some other places. But I think in the end, what Dr. de Villa said is correct. We have to keep in mind the ultimate safety and well-being in the broadest sense, including the benefits derived from going to school of the children and their health and well-being. But I'll be guided by the expert advice in coming to a view on that I would then put forward to you and to the province or to the school board as the occasion required.
Thank you. And then I have a question for Chief Pegg. Earlier today, Premier Ford said the province only received 24 hours notice about the latest shipment of vaccines. In your view, how has the partnership with federal authorities been on the vaccine rollout? Do you feel the communication has been clear between all levels of government?
So to be clear, and I think it's important to understand, the relationship with the federal government is a responsibility and the sole visibility of the province of Ontario. So we as a City of Toronto are not in direct correspondence with the Government of Canada, nor are we involved in any of those discussions or any of those processes. We sit and are directly connected to the province of Ontario, and all of the vaccine delivery and shipment and availability is provided to us in the city by the province. So we are entirely dependent and reliant on the good work being done by Ontario's Vaccine Delivery Task Force, and they are liaising directly with the Government of Canada.
Thank you. We'll go next to Lauren Pelly from CBC News. Lauren? There you go.
Hi, this is a question for Dr. de Villa as well as Mayor Tory. There's been a lot of updates lately on the international travel front. Today, the province announcing their pilot project at Pearson, for one thing, as well as the Fed's new rules for coming into Canada. Do you think that enough has been done in the past to handle international travel, especially with the UK variant and whatnot circulating? Or is this coming too late for you?
Well, I think that better that you get the actions in place, right? I think it's important that you adjust actions depending on what you actually see, and one has to adjust the course of action in accordance with what's happening in actual practice. I think that's the mark of a responsible and a very professional approach to managing a rapidly evolving pandemic. So I haven't had a great deal of opportunity to look at the details of the recently announced pilot in terms of voluntary testing at Pearson Airport, and I'll look forward to reviewing those details. But I will say this, I think it's actually quite useful to start these new endeavors in a pilot way, understand, the benefits and whatever opportunities there are for improvement as a result of introducing those new activities, and make adjustments to whatever the practice is, or perhaps even change to something altogether if the results aren't as expected or the desired outcomes aren't being achieved. To my mind, that's just the hallmark of good practice, whether it's in public health or in any other aspect of policy making or government.
These different initiatives, whether it's testing requirements or voluntary testing programs at the airport, can't hurt. But I sense there's an opportunity present here for the two governments in particular, and if we can help in any way, we'd be happy to, but for the two governments in particular, federal and provincial, to work even more closely together to have a fully integrated, fully agreed upon cooperative approach to testing of travelers that are arriving at Pearson Airport. I think that's in the public interest, and hopefully there can be more of that as we go forward.
More locally, I have heard criticism that it's not really just international travel that has been an issue, but the movement of people within Ontario from the different hot zones, whether it's people going to their cottage or just commuting between different areas and spreading the virus. Do you think that this has been enough of a focus? Is there more that you could have done to prevent Torontonians from going outside the city for leisure and non-essential work that might have maybe made a difference? Or is there anything that you think you could do now even to curb some of that movement?
You use a very interesting word when you say, could we have done anything to prevent Torontonians from going to a second residence they might have or some other part of the province? And therein lies, the conundrum that you face if you're in a position of decision-making responsibility in order to protect public health. I don't know that there is any way in which you could prevent Torontonians or any other people in the province from moving around to some extent. What we have done is Dr. de Villa, myself, others, the Prime Minister, the Premier, we've offered all kinds of advice with respect to staying home, staying only with the people that you live with, and so on. And I think that beyond that, there starts to be a very limited amount of things you can do effectively, especially in our society in particular, that are going to work in that regard. And there's been some confusing information out there as to whether people thought, well, it was okay as long as you went there and stayed there, or as long as you went there and didn't go out, this kind of thing. And so, but I think that when it comes to preventing, to use the word that was used, people from doing that kind of thing, that's a very difficult, very tall order in this particular set of circumstances.
Lauren, if I could just add to that ever so slightly. I think that what you've really gotten to the crux of the issue and the challenge that's been before all of us, whether it's here at the local level, at the provincial level, or the federal level. How do you deploy, how do you find that very delicate balance, right, between measures that actually limit the harms done by COVID-19 and at the same time mitigates the impacts of restrictions on activity. And sometimes that movement in and around the province is related to important activities like employment, which is, critical to our health. So it is a very difficult balance to strike, and one that we have worked very, very hard to achieve all throughout the pandemic. I suppose there are always opportunities for improvement, and I would like to think that we have taken all those opportunities as best we can. Looking at what's happening on the ground, observing the data, looking at the situation, and changing our course of action in accordance with what we're actually seeing and in accordance with the best available science.
Thank you. We'll go next to Richard Southern from 680 News. Go ahead, Richard.
Hey, good afternoon, everybody. Hello, Mr. Mayor. How are you today? Got a fun follow-up, but first, let me ask you a serious question, Mr. Mayor, about a dramatic scene that's unfolding right now in Washington, D.C. I'm not even sure if you're aware of this, but pro-Trump protesters have stormed the U.S. Capitol building, have breached the gates of the White House. A U.S. congressman calling it a, quote, coup attempt. Now, Mr. Mayor, we've seen, although very small, we have seen some pro-Trump demonstrations in recent days here in Toronto. Are you concerned about those growing, and what would your message be about any potential violence to these protesters in our city, sir?
I was so proud of the fact that during some very intense and very emotional and very heartfelt protests that we had in the summer with respect to racial inequities and some of the challenges we have in front of us there, that all of those protests involving thousands of people, while they were questionable from the standpoint of public health in terms of mask wearing and so on, were entirely peaceful and entirely orderly. That's the way people do things in this city, and I think if there are protests that have to do with Mr. Trump or anybody else, I'm confident that the spirit of those protests will be the same in this city, and that people will go about making their views known in a peaceful manner. I deeply regret what you've said is happening in Washington, but I guess that is for them to deal with, and it's really sad in the context of what is supposed to be the celebration of a great democracy, one of the world's great democracies, having rendered its verdict with respect to who they wish to have in a position of leadership.
All right, Mr. Mayor, we can all use a little bit of levity right now, I think. And a number of other cities in the province, they have suggested that people might want to go ahead and leave their Christmas lights up to spread a little bit of joy, during these tough times. I don't really want to take my lights down, Mr. Mayor. What's your message to Torontonians? Should we go ahead and leave our Christmas lights up to spread a little cheer, do you think?
If people can afford the small extra hydro bill, I'm in favor of anything that puts a smile on people's faces and brings cheer to the City of Toronto at this point in time. I only wish there had been a program like this back in the day when I lived in a house, when people would ask me why my Christmas lights were still up in July. I used to just say I was getting them up early, but they never believed that. So I think this is something that if people want to do it, I think it's a good thing. And I will in fact ask our own city staff here, because we have some wonderful lights that are here at City Hall that not as many people got to see this year, because we've asked people to stay home, that maybe if those were planned to be taken down before the end of June, consistent with that spirit of lightening up things a bit, that we might leave those up until the end of June. I'll explore until the end of July, rather, of January. I'll explore that with them.
Okay, thank you very much for that, Richard. And we'll go next to Dave Ryder from the Toronto Star. Dave?
Hi, question for Dr. de Villa. Doctor, it seems like listening your language the last week on when you're asked about whether elementary kids should go back into school and classes on Monday, it feels to me like it's shifted a bit from saying there's health benefits for kids going to school to focusing on your concerns about the indicators we're seeing in the spread, especially among young people. I just want to clarify, when you said that you have concerns and you've registered those with provincial officials, which you just said earlier to another question, what concerns are there? Are you raising concerns about elementary kids going back into school on Monday?
So, David, I actually have concerns both about COVID-19 and about the impacts on children should they not be able to attend in-person school. It is not an either-or proposition. As the mayor indicated, when we're talking about the health and safety of our children, it's the sum total. It's all aspects of health. Yes, of course, we're worried about communicable disease risk. We have high levels of COVID-19 spread all throughout the city, and we know that the higher the level of COVID-19 activity in the community, the more likely it is to pose a health threat to our schools and to the students and all the people who work within the context of those schools. We also know that there are health challenges absolutely associated with not having our children in schools, whether it's access to social programs or nutritional programs and contact with their peers and their friends to combat social isolation. There are all kinds of good reasons why we want to maintain our children in schools as much as possible. So all of the concerns have certainly been registered on our part with our provincial counterparts. We're continuing to have active discussions and are very hopeful that the best decisions will emerge very shortly.
Okay. Thank you. My follow-up question is for Chief Pegg. And that's, Chief, I guess most of us are seeing kind of two narratives on vaccinations, which is a lot of concerns from health experts and others about a slow rollout, about problems, and then very positive words from people like you saying, we're ready, we're here, we can do the mass immunization as soon as we get the vaccine. I'm just wondering, are there any issues, any problems that you're seeing so far in the vaccine rollout? And I guess obvious part of that is, when will you get the vaccine to do a mass immunization?
So first and foremost, David, you're exactly right. I am very optimistic about the work that is ongoing with respect to our mass immunization campaign plans. We've been hard at work on the development of those plans since early November. And like I said in my remarks, we really have one overarching priority, and that is to do everything that is within our power in the City of Toronto to make sure that we are ready to make vaccine available to everyone in the City of Toronto as very soon as it can be made available. We do rely on the province of Ontario for the delivery of those vaccines, and I can tell you from direct experience, there has not, literally has not been a day where I have not been in direct contact with General Hillier and his team. The work is happening every single day and around the clock to deliver as very much vaccine as possible. Of course, the province is dependent upon the Government of Canada for the procurement and delivery of those vaccines, which is all, of course, downstream from the manufacturing and ultimate supply by the various vendors. I don't think I would be speaking out of school to say that I don't think there's anyone, no one at this table, I doubt that there's anyone at the provincial table that wouldn't like to see an unlimited supply of vaccine made available today. I wish that we had all of the vaccine we needed and we could move forward to today. I'm sure that that's fair, a fair statement for literally our colleagues around the world. But at this point in time, we are operating within the confines of availability of vaccine. As the province of Ontario makes it available to us, our team and the team that I have the privilege of leading will make sure that we are ready and prepared to roll out and to deploy that to the recipients based on the province of Ontario's prioritized framework without any delay.
Okay, thank you. Final question is to Derek Dionarain. Sorry about that, Derek, from CBC News. Go ahead.
No worries. Thanks, Brad. This first question is for Dr. de Villa and Mayor Tory. I know you touched on this a little bit earlier about Quebec considering a curfew. Are there any additional restrictions that you guys are thinking of that might be needed for the City of Toronto or that you're advocating for with the province? And if so, what are they and why do you think they're needed?
So why don't I start off? Certainly we're having conversations with our provincial counterparts, and I have conversations with local medical officers of health from all around the province on a regular basis. At a high level summary, COVID-19 rates and spread certainly in Toronto and in many parts of the province are at concerning levels, and they're manifesting themselves in hospitalizations and in ICU admissions and unfortunately in deaths. And this is something that actually is within our control. Unfortunately, we are seeing people continue to interact with each other, with people outside of their homes, for what appear to be many times non-essential reasons, for social reasons. And this is controllable. So for starters, we're continuing to speak to the public around the importance of maintaining that distance and limiting their interactions to the greatest extent possible. With all others with whom they do not live. I think that continues to be a very, very important message. I do think that there's a lot of exploration, and we're having conversations, as I said, with other medical officers of health, other local public health units, and with our provincial counterparts on what other additional measures might be put in place to help support reduced contacts between people in order that we can get these case rates down. Certainly, we're looking at the experiences of other jurisdictions, and of course, each jurisdiction has its own unique circumstances to think of. And we also have to think about the mobility in and around the Greater Toronto area for reasons like employment and how you balance out everyone's needs in order to optimize health all across the board. And we're talking about health not only in terms of COVID-19, but of course things like employment, which are important for health as well. So lots of conversation happening on that front, and we're always seeking to update our advice and to update our measures with the best available evidence. So I'll see whether the mayor has anything further he wants to add to that.
I will just add to that I'm a lot of things, but one thing I'm not is a medical expert. And so Dr. de Villa would tell you that I phone her at odd hours of the day and night and days of the week to ask all the time, is there more that we could be doing? And so there's different things that get explored from time to time, and some of them have been discussed today within the context of schools and other things to try and do a more effective job at all this. But you know, when you boil it down, the two things that I hear most frequently from, because I reach out to health experts and other people that some in the media, some not, and they say, make sure that we do whatever we can to get people to follow the public health rules, most particularly to stay home and to stick only with the people that they live with and wear a mask and so on. And the second thing is get on with the vaccinations. Get that done. Get as many people vaccinated as quickly as you can. And within what's given to us and the rules provided to us by the province, we will get on with doing just that, and will, of course, encourage people to follow public health advice.
Thanks. And this last question is for Dr. de Villa. So Ottawa's medical officer of health is recommending that people wear masks as much as possible when they're outside. Is this something that Toronto should also look into? What are some of the benefits, and why has this not necessarily been a directive before?
So in fact, my advice has been and continues to be that when you are outside your home, wear your mask as much as possible, as often as you can. In addition to maintaining distance from others, as much as possible. There are moments where you have to go outside to attend to essential activities, whether it's going to the grocery or seeking health care or getting that exercise. To the extent that you are able to wear a mask to the greatest extent possible as an added layer of protection over and above distance, that's a good thing. And I have been providing that advice for a number of weeks now.
Okay, thank you very much. That concludes today's briefing. Our next update will be this coming Monday. Please stay safe.